Most women have an idea about how large they want to be. How they kind of put it into words, now that's it can be a little confusing. Like I said, I spend a lot of time with my patients trying to get to know them, exactly finding out what they want. I guess the best example is that, very thin, petite woman who wants to be a D cup, and she comes in and says, I want to be natural. Well, and I'm very, open with them. I'm like, great, I can make you look that way, and you're going to look great, but that's not natural, And occasionally, if there is any confusion, I have them come in and bring some pictures of what they would like to look like. So then, again, the most important thing is that everyone's on the same page before the surgery, because as long as everyone's agreeing, has the same expectations, achieving that is, pretty easy to do. It's just when the doctor's on one page and the patient's on the other, that's when you start getting into people who may not be as happy or satisfied. It takes about an hour and a half to do a breast aug. A little, and that's if you don't have to do any what we call mastopexy, lifting, things like that. Depending on if you have to lift the breast during an augment, that can take anywhere from 3 to, if it's a more difficult procedure, up to 4.5, 5 hours. I'd say a week, depending on what the patient does. The more heavy lifting, strenuous activities, maybe a little longer. But for most of my patients, I think if they take a week off, they're fine. Maybe a little bit sore when they lift their arms, things like that, but they're back to work within a week. Most of the ones that I see at first are size. I mean, it's a kind of their focus. Am I going to be too big? Am I going to be too small? Is this what I want? And again, part of that is spending the time. We even have some implants here that they can put under, their bra to kind of see how big or, what size they're going to be kind of enclosed. But I think probably the most important thing is actually spending the time and then kind of giving them the information, what to expect, mainly after surgery. The first day when they're swollen, they may get all, kind of freak out a little bit, going, oh my God, I'm huge, or, but if you give them that information beforehand, you are going to be swollen. And you're going to, at the first time after breast aug, you'll probably look in the mirror and kind of be really surprised. But, the swelling goes down, and if you can give them that information and they know what to expect, everything is so much easier. One, they're just happy with the results, obviously. I think the time I spend with them, I think I get to know my patients. It's not like 5 minutes in, 5 minutes out. I think they feel comfortable too, calling me or talking if they have problems, or calling me even at nighttime or even on weekends. I don't mind, and I tell them that. A couple of them will say, oh, I don't want to bother you. I mean, if there's a question, I want to hear about it. I want to hear about it before, it gets, if it is a problem, and I don't want to be surprised about it. And so I make that very clear. And I think that's why I get along with my patients as well as I do.